sponsored in part by Pediatric Associates of Dallas. Pediatric Associates of Dallas has been providing excellence in pediatric medicine since 1971. PAD has locations in Dallas and Plano and is now open 7 days a week because taking care of kids is what we do.
The following content is not intended as a substitute for professional legal advice, medical advice, diagnosis, or treatment. Always seek the advice of your attorney, advocate, physician, or other qualified health provider with any questions you may have regarding any medical or educational concerns.
Hi, everybody, and welcome. Welcome to another episode of Empower Dyslexia. I'm Rachel Chambers.
And it's her birthday.
Oh, yeah. Thanks, Stephen.
Everybody tell her happy birthday on all of our platforms.
Yeah. I'm getting on up there.
Well,
it's better than the alternative,
happens, right?
Yeah. So on the show, we discuss dyslexia and other related disorders, research. We have guests on that are specialists in their fields, and we also have people on that have personal experiences. So welcome to the show, and like us on Facebook and YouTube. Subscribe. And also, we do have subtitles on YouTube. So, and it's also in Spanish, I think. Or it wasn't working last week, but I think it is this week.
Well, check it out.
Okay. We're trying, guys.
Hey.
We're trying.
Provided in SAP.
Yeah.
Courtesy of YouTube and Google.
There you go.
Thanks, Google.
All right. So, as we always tell you, you can see us and hear us on all of our favorite apps. If you're watching, obviously you're watching on YouTube or Facebook Live.
Yes.
If you prefer your listening pleasures, we have iHeart, Google Play, Alexa, TuneIn, Spotify, all these beautiful apps. Look at them.
I know.
You can pick one. Pick
so
one,
many.
pick all of them.
There's
But
so
make sure
many.
you download Empower Dyslexia.
Yeah, please do.
We're just off the I see we're at a different time.
We're at a different time, and it's throwing us off.
Right. It's Friday. It's 2:30
Our
our
caffeine
time.
is worn off.
Yeah.
You're my last show of the week.
Oh, my goodness.
So, Rachel, you know that October is just around the corner.
It's coming up.
Next week.
I know. And the state fair is happening today, but
State fair.
on my birthday, it always opens almost always on my birthday. But after my birthday is the lovely month of October, which is Dyslexia Awareness Month.
Yeah. So, I mean, we're all getting ready for Dyslexia Awareness Month. Mm-hmm. Here at Empower Dyslexia, we want to put kind of a twist on Dyslexia Awareness Month.
Yes, we do.
You know me, I like to throw wrenches in just about anything I can find, including ceiling fans. Yeah, whatever.
Okay.
Doesn't matter.
Didn't know about that.
So what we're going to ask you to do is go speak at your school board.
Mm-hmm. Y'all, he came up with this great idea, and I highly endorse it. And I was like, yeah, let's do that. So
I come up with ideas every once in a while.
He's very creative.
I surprise
like
myself,
that.
right?
I thought it was a genius idea. But, we all know that I don't know if everybody does, and that's the point. We know, you and I know, and most of the people out there that know that they have dyslexia, that October is Dyslexia Awareness Month. So, but not everybody else knows. And so he came up with this.
Who holds the purse strings for your local ISDs? The school board. Mm-hmm. So what we were asking all of our viewers to do, during your month of October, your school board normally meets once or twice a month. Figure out what time it is. Go down to your school board and make them aware of dyslexia. Tell them why you say dyslexia. Talk to them about your experience in their ISD around dyslexia and dyslexia intervention. The great thing is that all of these meetings are public meetings, so they're all recorded. So then we can gather all of this information, all these videos, and put them together and
Make a montage.
Montage, whatever.
I would love to do that.
Make a
And maybe
montage
Ziggy
and a
could help us.
mimosa, whatever.
But yeah, you can go to your school board meeting, they usually have either 1 minute or a
Yes.
3-minute testimony.
Depending
block
on
of
how many
time.
people there are.
Yeah. And so you can go up there and sign up and give your testimony to the school board.
Yeah.
And then have your friend record it. Or you can just take their video. If they don't record, I don't know if all the school districts
They're all required
record
to record.
audio and video.
Yes, it's a public
For public
forum.
record.
Yeah.
Okay, so there you go.
So all your school boards should have, or school board meetings should have a link to a live stream of it, or even a recorded stream, and then we can go in there and grab that video.
Share it with us, guys.
Yeah, share it with us. We want to see what's going on in
And
your
maybe-
ISD.
Yeah, maybe that testimony that you do will change the course of your actions that your school takes.
I've
that's
seen it.
the hope.
I've seen it happen firsthand.
Yes, you have. Stephen has had very good success with that. Just saying, hey,
Yeah. Here's the
this
information.
is dyslexia. Let me tell you about it. So, okay, well, we look forward to hopefully getting some recordings from you guys. So, on the show today, we have, she's just awesome. We met her when we were in DC. And so her name is Dr. Gina Forchelli. And she is a licensed child psychologist and nationally certified school psychologist. I'm sorry, I'm reading so slow. At the Learning Emotional Assessment Program, LEAP, within the Department of Psychiatry at Massachusetts General Hospital in Boston, Massachusetts. She is the co-director of postdoctoral training at LEAP and an instructor at Harvard Medical School. Dr. Forcelli, she specializes in pediatric neuropsychology, psychology, and educational assessment of children and adolescents with learning, emotional, behavioral concerns. And she works closely with children with dyslexia and other specific learning disorders, ADHD, developmental trauma, PTSD, autism spectrum disorder, depression, and anxiety. She has completed training across multiple settings, including outpatient trauma-based clinic, which I know that kind of stuff, residential therapeutic school, public schools, and post-secondary and college settings. So she is very experienced, very smart lady, and we're so excited to have her on the show today. So welcome, Dr. Forcelli. Hi.
Hello. Thanks for having me, and happy birthday.
Oh, thank you. Thank you. Another year. So, yay.
Another year. So great.
Yeah.
So thank you for having me. I'm so excited to kind of maybe start off Dyslexia Awareness Month. That's such a great
Yeah.
idea.
Well, we're kind of starting a week early, but that's okay.
That's fine.
Well, we got.
Dyslexia doesn't stop after 1 month, right? So
That's what we
I think
thought.
you're okay.
Yeah.
I've been having Dyslexia Awareness Month for 45 years.
Right. Exactly. Exactly.
Right. So, well, why don't you tell us a little bit about yourself?
Sure. So I'm a neuropsychologist. So what I do are the evaluations that you would do for children who are having learning, behavioral, or psychological difficulties. I tend to see a lot of kids at LEAP, where I work in Mass General Hospital, that tend to have learning difficulties. We're the more applied clinic at the hospital. So when you have a child struggling with not kind of being able to meet the needs at school, or parents want a second opinion, they usually come to us at LEAP. It does take quite a long time to get in here because so many parents want that kind of second opinion.
We heard.
I know you talked to Marilyn a couple weeks ago. Unfortunately, our wait list is quite long.
Yeah.
Which kind of speaks to the need for kind of more comprehensive support for these kids. And so what I do is I do the testing and basically help kind of walk parents through their child's strengths and weaknesses through the types of testing that I do, and then help them kind of with the next steps, right? So what information they need and who do they need to get in contact with to really get the support that the child needs to kind of perform the way that they expect them to and that we know they're capable of.
Awesome.
Yeah.
Very good.
Well, so I mean, obviously we speak to a lot of parents that are out there that are in all stages of this journey, right? The people that I've been dealing with a lot over the last few months is more on the very beginning stages. We just within the last few months are identified. And I'm starting to see kind of this same pattern with these parents trying to figure out exactly what it is that they're going through or what they're up against, right?
Right.
Do you kind of see that same thing in your practice? Some of the things I'm seeing is kind of the same thing with grief, like whenever these parents are going through, or the 5 stages of grief, when they're learning about all of the stuff that's going on. Are you seeing that kind of in your practice also?
Absolutely. I think there's a lot. So by the time they get to me, they know that there's something wrong, right? That there's something different in the way their child's learning, and by the way that they're getting supported, it's not enough. And so when they get that diagnosis, I think there is an initial relief, right? There's a label, there's something that I can hold on to. That's the reasoning why my child isn't performing. It's not that they're just stupid or that they are lazy, which is what I hear from a lot of teachers, that there is a kind of neurological reason for why they're struggling so much. So I think there's an initial relief a little bit, but then there's a lot of terror, because I think there's a lot of misinformation and just lack of understanding of what dyslexia is, and not knowing what those next steps are. So initially, I think parents might be in disbelief. But again, like most of the time when I see a parent, they kind of know something's up. They know that there's something different in the way their child's learning. They just don't know what exactly it is. And they might be confused because they might be being told by their school district that they'll just catch up. They're a little bit of a slower reader, that they don't need to do anything. They don't need to worry. But kind of like what I talked about in Washington, D.C., they have that kind of parent intuition that it's something more. And so then when they kind of get over the relief, there's something to call it, right? And beyond the denial piece, because I think by the time they get to me, they don't really, there's no kind of question that there's something there. They get angry because they're really frustrated that they've either been given misinformation, they feel like they've been misled a lot of the time, or they're angry with themselves because they feel that they're to blame, that they're the reason why their child is struggling. And that, I think, is the hardest thing for parents to get through. And that's kind of when I provide more resources for them to kind of get more information around what it is, what it isn't, and kind of how to advocate for what their child needs and kind of give them a purpose for that anger.
Yeah, I actually spoke to a group of parents earlier this week, and that was one of the questions I asked is, we're in a small group, about, 25 or 30 parents, and I said, we're all safe here, we're among friends. Who here actually feels like it's their fault? They're responsible for their child's dyslexia or disability. And, slowly but surely people started raising, they're doing these right here, And I said, well, dyslexia is genetic, but that's about as far as it goes.
Right.
What you do from here on can be your fault.
Oh, very well stated.
So
the whole denial process is like, okay, get your head out of the sand and you gotta act.
So we're going to go from this stage over here. We're going to act.
And what do we do? What do we do?
Yeah.
That's the thing. Like, what do I do now? I don't know.
And that's fine. That's a great stage to be in, because now you've accepted it. You know it. You got a name for it, and you're going to move forward. But you can't sit there and blame yourself, because all that's going to do is put you in a state of anxiety and being frozen to do anything. Right?
Yeah. And it is kind of what it is.
Right.
Well, I also told those parents, I said, look, this is your child's dyslexia.
Yep.
It's theirs. It's theirs to own, and we have to empower them with this.
Well said. Yeah. Because there's a lot of things that they can still do. Just because you have dyslexia does not mean
it's not a death
and
sentence.
so,
So what kind of advice do you give parents, and then like what kind of advice do you give the student? Because you talk to the student as well,
Yeah.
right?
So I think first and foremost is kind of to understand what dyslexia is and what it is not, right? So because we kind of have been in the world of dyslexia, we know that it's a neurocognitive disorder that kind of influences the language-based processes in your brain, right? But most parents don't get that. And I think in kind of preparing for this, they also don't get that information at school, because a lot of times school classifications don't have dyslexia as a cluster. They have a reading disability. So they could be confused on if that's different or if that's the same for them. So really kind of helping them understand what dyslexia is and why it occurs so frequently in kids, I think is really crucial, because then by knowing what areas of the brain it's impacting, you then know what type of interventions they need to be looking for and how to advocate for those. So I have parents go to kind of websites like International Dyslexia Association, understood.com, your kind of podcasts and blogs, just so they can kind of understand what dyslexia actually is and kind of validate that it is something, right? Because there's actually a couple of school districts in the Massachusetts area that kind of don't consider dyslexia a diagnosis. Yes. So
What do they say? What
even
do they
in this day and
consider
age,
it?
right?
I mean,
So
what do they call it?
they just call it a reading disorder, which fine, you can call it that too. But I mean, the research for dyslexia it's a little different than just like a basic reading disorder, that there's a neurocognitive pattern for why they can't read. It's not just that they're a slower reader. And so I think giving them that information is really important. And then how to advocate for those, depending on the level of dyslexia too, is important. So once they've kind of come to terms with the diagnosis, how they need to advocate for themselves in the school district is like a whole other undertaking, where parents really almost need to get a degree in law and special ed law, right? So they need to understand their rights. So there's a lot of great resources. I'm blanking on the name, around
rights law.
helping parents. Yes, thank you, rights law, on what their rights are as a parent in the school district and the special education sector. If they don't have an IEP, kind of walking them through how to kind of ask to start that process, or if they do, kind of going the route of how to challenge if I don't think all the programming is sufficient, how to kind of go down that path. And so it'll be different, kind of dependent on the kid and the school district and the level of disability too.
Let me ask you a question. So
Sure.
you said, and you will know, I'm sure, but so if the school district is not saying dyslexia and they're calling it just a broad reading problem, what intervention do you get when you're labeled reading a slow reader or whatever they call it? I mean, is there a different intervention, or is there no intervention, or they just get more time, or I mean, how do you do? Is it the same? Do they get an intervention? I'm so confused. Why is this so confusing?
So
Why?
think,
Penicillin or no?
Yeah. What?
I don't know. So I think in my experience, sometimes it depends on the level of training that the programming will be. So who is actually implementing them? It can influence what type of program it actually is too, and like the level. So I don't have like a one-to-one comparison though. Like if I saw one kid with a reading disorder in that school district versus one that was diagnosed as dyslexia, but I do think there's a difference in perception of a child who has dyslexia versus sometimes just being classified as a mild reading disorder, where they're just a little bit slower in reading. But I think that gets to the point of kind of what programming looks like in the school and how parents need to kind of be keen on what's a good program and what is not. And that's another area they need to kind of become experts in or get expert advice in, which is what I try to kind of help them, steer them in the right direction of research and people that can help them kind of learn what those programs look like to advocate for their child.
I mean, it's something we say all the time. Ask why. You know, what is this program? Why are we using it? And what is that
What's
program
the purpose? Yeah.
specifically going to do to help my child?
Yeah. What's the benefit? What's the overall outcome of that program? What are we going to expect from that outcome? Is
Well,
he
yeah, I
going to be
wanna-
able to read, write, spell?
Right.
Yeah.
So that's the goal, right?
Hopefully, is it going to work?
Yeah.
So okay.
Yeah. And basically, if that program has a research base to use it. So I know we talked about this a little bit when we were preparing for this, where some programs don't have the best research base, but they're used in schools too. So is this what the International Dyslexia Society or Association says is what you need to be doing for programming for dyslexia? Is it systemic or structured literacy, where it's building on phonics, it's sequential, it's phonics based, and building on those skills as they get to higher levels? Or is it something that is not that's newer and maybe shinier, but doesn't really have enough research to say that it really does help kids learn to read?
It's amazing. It's amazing. This is where my brain is my head is like
Yeah.
beating against
It's
the
hard.
wall. It's like if science doesn't win.
It reminds me of
don't
have you
know.
seen the cartoon where the guy's trying to get into the door and he's pushing really hard and it says pull?
Yeah. Yeah.
And look, I've got to use humor, otherwise it just sends me over the edge.
Yeah.
So I got,
Exactly.
Well, and I
too.
think most school districts are well intentioned. I'm not
Of
trying to
course.
bash
I know.
every
Of
school
course.
district, right?
Yeah.
It's just that I think there's not enough knowledge about what is the best. We are still debating what the best way to instruct all kids in reading is. So there's a lack of knowledge, particularly with general educators, in kind of what is the best way to approach kids with dyslexia. And that's why they need these kind of specialized programs, because our literacy programs are not really set up for them.
yeah, I mean, I can't even talk. I've said this a number of times. I've never met a teacher that says, I'm going to make sure that kid fails, or I don't want to help that kid.
Right.
I mean,
Absolutely.
We know that they're out there, and we know that they truly want to help these kids and educate these kids. And we're here to help educate them too on the research that we're doing.
Because we are talking to so many fabulous people like yourself, and
Thank
you
you.
guys have been in school for so long and know what is available and out there and what works better than other programs. It's
Yep.
like, let's listen to the experts, let's listen to the experts, the people that have been in school for eons, and see what they have to say. I went to school for a little bit, but that doesn't mean I'm an expert in reading, but I like to talk to people.
Right.
So let me ask you this. Let's back up, I guess. So the student has gotten a full individual evaluation,
Okay.
or maybe an IEE, which is an independent education evaluation, which is what you do, the IEEs. So they have their diagnosis. Well, we already kind of went over this.
Well, I mean, it doesn't hurt.
We can review it.
Yeah. we can't say it enough. So
you give them the information, you move down the street, you move down the road, and hopefully. Tell us what's the difference between the FIE and the IEE in your, because you do, you just tell us. Tell us
Sure.
what you do compared to what what you'd see in FIE.
Sure. So I actually used to do the FIEs, and that's, I think, more of a Texas term. So in Massachusetts, just like I think we just don't use the acronym. I like the acronym. We just
we're
call
all
it like
about
a comprehensive psychoeducational evaluation. And so I think the difference, at least for Massachusetts, kind of where I am, every specialty does their own testing. Right. So this child is meeting with 5 different people to kind of get tested in these areas. One being the psychological testing, so your general IQ testing, and maybe some behavioral rating scales to see if they're feeling anxious, if they're feeling depressed. The educational testing, which does just kind of the more academic testing, so some reading, some writing, some math. And then there's some other areas that they could get. So occupational therapy, if maybe they have a hard time with handwriting, physical therapy if there's kind of some concerns with gait or any like walking, things like that. And then everyone kind of comes together with their small evaluations kind of to kind of make a bigger picture of it. What I do is I do it all at the same time. And I think there's an advantage to doing that because I get to kind of make decisions as I go of things to kind of look at even further because I have all the data in front of me. So for my evaluations, I'm able to kind of notice when I am seeing kind of a history of difficulties learning letters, learning numbers, difficulties with kind of language-based processing where they might have tip of the tongue or word retrieval issues, or just kind of noticing patterns as they're performing throughout the test, that I then can gear my evaluation more towards other areas of cognitive weaknesses that you see with kids with dyslexia. Like I might give a different type of academic measure than another on a certain day, depending on the type of kid. So it is more, I think, individualized. I think schools do the best they can, but I think an outside evaluation that's comprehensive and it's one person doing it all to kind of see the big picture is really helpful, I think, for parents because they can see it all in one place and it all happens on the same day. So there's less variability across testers and across days, because sometimes they have to do assessments over different days. So it really kind of gives you a comprehensive picture all at once. And so that can be really helpful for parents to be able to see everything together. And then I spend time going through every single data point to help them understand where my kind of conclusions and recommendations are coming, where you're having 4 or 5 people talking at you
Uh-oh.
but one.
You broke up.
Hold on.
Hold on a second.
We're having
Oh.
technical. Okay, I think we're back good. Okay, so I'm sorry. Continue.
I don't know where I left off. Where did I break up?
You were saying that you get to see them on, throughout the whole process. So then it's less, I think, variability.
Yeah, so it's less variability kind of across people who are observing the behavior or the difficulty. But then in the sum of all that data, I think the way it's presented can be easier for parents because they're only having one person. It's only me and the parents talking. There's no liaison, advocates. There's not 20 people kind of talking to me at once about what's happening to my child, but it's more intimate and kind of creates a better connection where the parent might be able to hear and understand things better.
Mm-hmm. It's fascinating, the difference between the two. Because, my son, we're going through that process right now. We got an FIE, or full educational evaluation. They did the educational part. They did OT. They did some speech. I think that's it. And now we're setting up for the ARD meeting, or what we call what does that stand for again? I forget. I forget.
There's so many acronyms.
Academic. I don't know.
Sure.
Yeah, it's the first meeting before the whole IEP.
The results.
Yeah.
Okay.
It's just fascinating. And then you're going through the same process right now.
I'm going through some educational evaluations, and I have to tell you, it takes a very special type of person to do these type of testing. I can tell you from the adult side, I don't know that I would have been able to do it without feeling very comfortable and being able to be so open and vulnerable with the person that I was testing with. So to me, that really tells me a lot about you, Dr. Forcelli, and just kind of being able to talk to you on the phone. I can see how you are, and you're funny and laugh and joke around a lot, and that alone, being able to build that rapport and that relationship with the person that you're testing, and then for the parent coming in to hear all of that information and take in all that information, it just
it's a lot to take in as a
it
parent.
is, but
because I've only been on the parent side of it, and I can't imagine what my children being on that side of it and what you're going through right now. But it's not like it's brain taxing, like
Yeah.
what you've said. It's just you're really tired after you've been.
I left.
Oh, yeah.
I left the other day, and I was like, man, my brain hurts from my eyelids to like to the
Yep.
back of my brain. I mean, she was having me do stuff. I was like, what?
Yeah.
Your brain is doing
like,
sit-ups and squats.
Yeah, can I? Are you sure I can't use my calculator? Come on.
Come on, let me use my fingers.
What about Excel? Can I use Excel? Because I can do it in. So, but yeah, I mean, my brain hurt. But the point of that was, you know, you were talking about being able to sit down with a parent and talk to them and get them to understand exactly what's going on. I mean, it takes a special type of person to be able to be that open and really have the buy-in from the parents and understand it. So, you know, that's awesome that you get to do that every day.
Yeah, thank you. And I feel that kind of comes with kind of speaking about that parents want to be listened to. And I think a lot of times they don't feel like they're heard by their school district. And that's also another reason why they end up coming to me, because they feel like they're saying the same story to the same people and they're getting the same response, but like they're hitting a wall. And it comes to a point where they then have to go outside into more of the clinical sector to kind of get that attention that they feel they need. And so I feel that can be really hard for parents too, where they're told not to worry about it, or they are making gains even though you're not seeing it, or you don't think it's happening. He is, or she is. And so it can be really validating for the parent to kind of get this evaluation that actually shows, well, I mean, they're making some gains, but it's not enough compared to kind of all the other potential that we see in the rest of the data. And I think it's also pretty valuable for the kid. And I know we talked about this before as well, where the kid knows that they struggle. They probably feel very stupid because the only thing you have to do from kindergarten to third grade is learn how
You cut out again.
to read. Or how many times? Oh, sorry. Where did I stop?
So
Where did I cut out?
the only
only-
kid, the only thing the kid has to do between kindergarten and third grade is learn how to.
Read.
Agreed. Absolutely.
And so,
Right.
and if you are that child that can't do that one thing that they're asking you to do, you're going to feel stupid. I don't care what any teacher tells you. They're like, no, they're fine. They're doing great. If you can't read the way your peer does next to you, you're going to feel stupid.
Oh, yeah.
And so by the time they get to me, they think they're dumb. They think they can't do anything. And so then when I can have a conversation with the kid around, no, like there's just this part of your brain that we call dyslexia that makes it just different in the way that you learn to read. And it's just a little bit slower to learn it. So, and I try to compare it to any other muscle in the body. So I try to do sports for boys sometimes and girls. Like if you had to practice your pitching, it's clear I don't do sports. If I had to throw a ball, would have to practice it a bunch of times before it got strong enough and got accurate. So that's kind of how I explain what a dyslexic brain needs to do. It needs to train reading in a different way so that it builds that muscle up, so that they can read the way that other children just kind of do inherently sometimes.
Yeah, I mean, you can call it whatever you want to, but at the end of the day, when that child lays down, you can't lie to yourself. You're not going to be able, the child's not lying to themselves. They know exactly that there's not something quite right.
Yep.
Oh, they see it every day.
So, I mean, we
They
gotta
see it every day at school.
we gotta make sure that we put our arms around them and say it's okay. We're gonna make it through it.
Yeah, we're going to make it through it.
Yep.
And, oh, by the way, you're good at XYZ too. Remember that?
Yep.
Even though you're not good at reading right now, you are good at all these other things.
Yes.
So we're going to get you better at reading. But in the meantime, remember that you're really, really
Well, we're gonna
great.
make sure that we take your weaknesses and get
then
them to the
strengthen
same
them.
size
Yeah.
or same level as your strengths,
Yeah. It's going
or
to
as
take
close
you,
as we can.
Right.
As close as we can, yeah.
As close as we can. And it's going to take you a little bit longer, but we're going to get you there.
Exactly. And what's easy about my job is usually kids with dyslexia do have a lot of strengths. They're not kids, they're kids that have learned, particularly the ones as they get older and I see them. They've created strategies. They're pretty crafty because they learn kind of like what Marilyn said a couple of weeks ago, the stealth dyslexics. They learn ways to get by, right? So they have really good problem solving strategies that have gotten them through thus far. So you kind of can use those and build on those while you're also giving these kind of research-based strategies to kind of really create growth in a child and make them feel empowered too. I feel like a lot of kids feel helpless because they do feel it's something that's out of their control, but you're kind of giving them control back by giving it a label, compartmentalizing. So it's only part of me, it's not everything. And then also telling them about their strengths, which they probably don't hear that often.
Yeah, they're always being
Yeah.
reprimanded about their weaknesses.
My strength was always getting somebody to do my homework.
Hey, that's a good strength. That's a good.
It's a great strategy.
That's my strategy.
I kind of did some of that too. So, you do what you have to do to get
Right.
by. I mean, right? If you don't teach them, you do what you do to get by, whether it's right or wrong. You just figure it out because we're survivors, right?
That's
You are.
what they say. They wrote a song about it.
Which one is that?
More
I'm a
than one.
survivor.
Yeah.
That's Beyonce,
Stop
right?
it.
That's Destiny's Child. If you will.
Destiny's Child. Oh, sorry, Beyonce. Sorry, Destiny's Child. Hold on, wait, she was part of Destiny's Child.
She was, yes.
Yeah.
I have no idea.
Yeah.
You were thinking of Eye of the Tiger,
No.
Survivor.
I was thinking of that song, but
Yeah, I know. That was my
He
first
doesn't
song
wanna
for my
admit
high
it.
school. I know. That shows your age.
our apologies to Kelly Rowland and the other member of Destiny's Child.
Oh, but hold on, wait. So
Michelle?
Didn't you get a minor in music or something like that? You should know this better than
I
me.
was a double major. Yeah, I was a music major in college.
So was it? We're going off topics totally right here, but what? I mean, did you?
Wheels off.
What, wheels off today? It's
Wheels Off Friday.
Friday.
Birthday. I'll answer whatever question you
It's my
want.
birthday. Sorry. No,
I
so
need to hear that song. It's your birthday. Da-da-da-da.
you say it's your birthday.
Yeah, that one.
Da-da-da-da-da. I'm a good singer, y'all. Not really, but so were you like guitar, keyboards, opera?
This is so funny. I was an opera singer.
Opera. I knew it. I
So
see
can I put you on the spot? Give us some opera.
No, absolutely not.
opera via Skype.
Yeah, no. I need a little more prep for this.
You have to warm up the vocals a bit, I'm sure.
Yeah, just a little bit, you
That's
know.
impressive,
But yeah,
though.
no, I studied that in undergrad.
That's so cool.
Oh,
I don't know how opera
thanks.
people do that. I just don't know how they do that. It's amazing. I really think it's amazing.
Yeah.
So
Thanks, guys.
What were you gonna say,
No, it was
Ziggy?
a lot of fun.
Just the main theme from Carmen, just real quick.
Nope. No.
she said no.
I'm here to support dyslexia.
Yeah, okay, sorry. Well, we digress. Oh my gosh, Stephen, we are wheels off today. Okay, so back on topic.
But music
y'all.
is great for
It
kids
is.
with dyslexia, right?
It
So
is.
they've actually done some cool studies that show that music is kind of helpful for kids that are learning to read. And it's also something that has nothing that can give them feelings of empowerment too. So they're doing an activity that makes them feel good about themselves. They can kind of express things in a way that's less language based. So to bring us back to dyslexia, music can be a great after school activity. to get
It's
kids
very
involved in.
therapeutic and happy.
I was in choir all the way through school.
Were you really?
I
Me
was.
too.
I didn't sing opera, but
So choir at church or choir at school?
choir at school.
So you're like Glee.
No.
No, I mean, so he should be singing too.
Come on,
Yeah,
just the main
we could
theme
do
from
a duet
Carmen.
there.
Okay. Oh my gosh. Okay.
right,
so
so let's get
moving
back to
on. Moving on. Okay. So okay. We've gotten our diagnosis label,
Yep.
whatever you want to call it. And the parents are like, we've already said this. What do we do? But here's the question. And you say you're a New Yorker and you tell it like it is, which I love because I'm not from New York. I'm from Oklahoma, but I kind of tell it like it is too. But so what are the parents? I know we have that in common. But what are the parents up against? Like in your neck of the woods in Massachusetts, what do they need to get geared up for? One, and then for example, like your area around Boston, in the suburbs and the outlying. So if you know a student lives in a particular district who is notorious for, denying interventions, the 504s, not following the IEPs and that sort of thing. What do you recommend that parents do when they're in that kind of situation? I mean, you know that this kid is, not in the best environment for that, because some school districts are very, they're just not able, for whatever reason, for lack of better words.
Difficult.
There you go. Very difficult.
So I think first and foremost, I try to help, I try to urge parents to go back with this information to the school district to work with them collaboratively. That's usually my step one, because you really want to try and keep a positive relationship with the school district and kind of get them to hear you and hear your voice. And sometimes the data in my evaluation can kind of really open the eyes of the school district of, oh, maybe we do need to increase this to 4 days a week of intervention instead of 3, or maybe we do need to do individual over small group reading support, right? So I think trying to work with the school district is usually my first line of defense, right? But a lot of times, unfortunately, that's not going to get them what I think they need. Because sometimes their dyslexia is at a point where I don't think inclusion model really works that well anymore, or just the one-on-one reading tutorials are not really making any gains because they're only getting it like for a 60-minute interval. They might need a more infused program. And that's when I kind of have to have a frank conversation about the resources of their school district and what the path might look for that type of child. I usually recommend that first meeting where they're kind of going over the results of my evaluation to go over it with the school district without any extra support, just to try and keep a collaborative model with them. But
Meaning
if they're
no
feeling
advocates, no lawyer. Is that what you mean?
Mostly.
Or-
So, I mean, I think that when you start to bring other people into the school meetings, that relationship's going to be different, right? So the school can sometimes take a more, not always, sometimes they're fun, but they can sometimes take an adversarial approach, like you're coming with your guns loaded, I'm going to also come with my guns loaded. So I think just assuming at baseline that everyone wants to do the best by this child, let me present you with this new information that I got, and this is what Dr. Forcelli wants me to get. What do you got? And if you, out of that meeting, you think you're not being heard, they're not doing what I asked, or even like similar to what I asked, they might not be able to do everything I asked for, but most of the things that are most important, that's when I kind of recommend they either search for an advocate in their area that has experience working within their district with that school system, to kind of know what you're up against. Because I work with so many different districts, I don't actually always know what schools are capable of, if they do have reading tutors that are Orton Gillingham trained, or if they do have a language-based program that this child could easily, seamlessly go into, but they're just kind of dragging their feet around it. So that advocate will kind of have a better understanding of what that what the programming in that school district looks like. And sometimes I have to tell the parents that if it is a lower resourced school district that I kind of know, or there are more adversarial school district that I know of, there's just the system is kind of there. I have to have a frank conversation with them also about the alternatives, that they could go the road of fighting the school district the entire time and paying a lot of legal fees and hearings and like settlement meetings. And that's a long road. That can take years. Or using the money that you would pay for a lawyer for me to testify, for another observer to testify, if that money is better spent by A, maybe moving to a better district, B, in a private placement, and really having a frank conversation around that. And it's a lot and it's overwhelming. And I never tell the parent what exactly to do, but I like to give them that kind of frank information because it's hard. And not every case is the same and every kid is the same. So I can't tell you what's going to work for every child, but I have to tell them all their options that they have to kind of prepare themselves for.
Can I just tell you this real quick? Which I just found this out. Like, I'm on the state committee, and we talk about that occasionally. It's the Special Education Continuing Advisory Committee is what it's called for Texas.
Oh, fancy.
It's a big mouthful. But so I was reading over, because we came up with some law changes and policy changes. Our committee has been tasked to do that just after the whole federal investigation that the state of Texas went through. And so one of the laws that we suggested be changed or add, one of the bills was, and I'd forgotten that we did this because this was a year ago, but and it didn't go anywhere. But was to find out how much money the state of Texas is actually paying on lawyers and court fees and all this. But I don't know if they wanted to do it per district or for the whole state. But yeah, I thought that was very interesting, because it would be very interesting just to weigh out, like, okay, well, how much does it cost to, like, not provide services and go to court rather, and then to how much does it cost to just provide services? Or maybe
It's always going to be cheaper to provide services. I mean, it just is.
I
When
don't
you look
know.
at
I mean,
everything
it's-
that's involved,
it's in, like, the heartache and but
Yeah, it's a lot.
I mean, who knows?
And it's
I don't know.
Ooh, sorry.
It would be
and
nice
it's
to find
not-
out, though.
Yeah. And it's not just providing services or nothing, right? It's not an all or a black or white system. It's what the quality of the services
Correct.
is usually where you get into litigation. So usually if you push back, and they're going to kind of, you'll come to a settlement that, yes, they'll qualify for an IEP. They might get some services.
Right.
But what does that service look like is kind of where I think you can get in the weeds. And you kind of have to really know your rights, and you need to know what the research says is best for kids with dyslexia. And that's what I think can be a real challenge for parents, because they'll be like, oh, they got tutoring 3 days a week at the school for 30 minutes. And I was like, well, what type of tutoring? And they'll be like, oh, I don't really know. And so that's the piece where you really need to know and ask the right questions, but you don't know what the right questions are until you know. Right. So that's why kind of that information gathering to kind of prepare yourself for the meeting, maybe have your list of questions that I kind of can prep you for too, to kind of ask those questions. I can't give you every one, but just knowing what you need to ask to getting the right services, not just any services.
correct.
Yeah.
So this question came up when I was talking to the parents the other day. They were asking,
It's a good question, too.
because I was that defiant child, how do you deal with a defiant child once they get the diagnosis or get labeled with dyslexia?
Yeah, and they don't want to do the intervention. They don't want to.
Yeah, they're the child is pushing back 100%. No, this, I'm not doing this. This isn't me. I mean, I tell the story about my parents wanted to send me to, at the time it was, I think, one of the only dyslexia schools here in Dallas. And we walked in, and they had the big, long, like, classroom. Well, it wasn't a classroom, but just big, long conference room tables were in the classrooms, and kids had their Cokes and food out there. I mean, it looked cool. I mean, I can't lie. It looked like, hey, this would be a fun place to be in. I turned around and looked at the person, and I go, so do you have a football team? And they go,
what grade were you in? I forget. Well, you had
seventh.
to, it couldn't have been
7th
grade
or 8th,
school.
something like that. So,
Yeah.
and she looked at me, she goes, no, we don't have football here. I was like, nope, I'm not going.
Yeah. Yeah. Yeah.
I mean, I told my parents, I said, hey, you can try to send me there. I'll get kicked out. And of course, I was being
You little stinker.
I was being you want to talk about defiant, that was me. So anyway, the question is, what do you do with a child who's becoming defiant and won't do intervention, won't accept the diagnosis? What do you think?
Yeah. And I think my first question is trying to figure out where the defiance is coming from. So most kids their behavior is telling you something about how they either feel or improve. So for some kids, figure out kind of,
Hold on
hello?
a second, you were breaking up.
Yeah,
cutting
you're
out?
breaking up again. Oh, some kids, you said you have to know where the feeling's coming from.
You have to know kind of where the behavior is coming from. Because my base assumption is that most kids like to do well. Most kids like to feel good. And if a reading intervention is supposed to get them to feel better, then doesn't make sense why they would be defiant. So we have to kind of unpack where that's coming from. So is it because wrong intervention or the wrong type of instructor is usually something I think about. So if it's like a kid in 3rd grade who has a difficulty with reading and he won't participate in a small group, is he actually getting the right type of instruction? Does it need to be one-on-one because he's also a kid that has maybe some attention weaknesses and can't really sit still unless there's an adult with him one-on-one? Is it because the other 2 kids in his group are really not at the same level as he is in his reading needs, and so he gets bored, or they're moving too fast compared to his reading level? So I think if we're talking about defiance while they're in an intervention, you need to kind of think, is it the right intervention then? Because again, my base assumption for most kids is that they like improving. They like to feel good about what they're capable of. And I don't believe that most kids are willfully trying to do it. I think it's based in something else, just to be oppositional. And so that's number one. So to kind of see if it's an intervention based. If it's like a kind of a holistic defiance around because they don't have a football team,
Right.
I think unpacking
that's a different
a little bit more. Right. I think unpacking that as a parent, there's probably fear. There's difficulties maybe assimilating into a new setting. And then there also has to be parents that just have to put their foot down if they know what's best, because it's still a 7th grader and they're still under your roof, and kind of managing, right? So, and managing the demands with that. And I'm sure no 7th grader wants to hear that, but
that's a hard transition. It's a hard transition.
So what are you trying to tell me?
That you're a stinker.
Golly. Thanks a lot.
Looking back, there's probably a fear of change. There's a fear of new things. There's a fear of failure because your parents are putting more money towards your education. And so there's a lot of pressure around that. So you probably look for the 1 or 2 things that, how can I have, maybe what will keep me in my safe zone. I think kind of helping kids unpack that, because they can't always express, I don't want to go to this school because X, Y, Z, because I'm scared, because I don't want to fail anymore, because I'm just used to where I am and I have friends there.
Right.
Unpacking that a little bit can be helpful, and kind of knowing as a parent that you know better. Your kids know enough about what their needs are, but you know your kid your best. And so if you feel like that's the best setting for them, kind of working with them, maybe with the support of like a therapist or with their school counselor at school, to kind of help manage those things as well.
Right.
Yeah.
They also asked, well, would you have gone there? I said, absolutely. Yeah. I mean, I kick myself all the time for being that defiant. And you're right. It was fear. It was not wanting to leave my friends, and the
middle
unknown.
school is so hard anyway.
Well, it was,
you're
being taken away from, like you said, your safe place, and you're being put in
unknown.
Well, at that point, I was thinking of it as the special school.
Right.
Right.
Yeah.
I hear that all the time.
And I was like, I'm not doing that. But anyway, yes, you are
hard.
absolutely 100% correct.
And so I think having a very frank conversation with your kid, like, yes, this is super scary. This is going to be hard, but I'm here for you and I know what's best. And this is why we think you need to go here. And if you do start to be defiant, or if the child starts to kind of try to thwart your attempts to get them in the school, or they're trying to get kicked out, basically, I think maybe working with the school that you end up at on how to help them manage that in the school system. They're probably not the first kid that has tried that.
Right.
Oh, sure.
And so then working with his teachers, and if they usually do have multiple learning specialists, maybe an adjustment counselor at that school as well, to help them kind of manage that transition.
Right.
Yeah, I mean, it's a hard transition.
It is.
Especially, I think, when you get them when they're young, and that's our whole thing that we talk about, and then the state of Texas is now doing, is identifying really young, kindergarten first, and and then it's not such that huge educational gap, and then that huge transition that you may run into down the road when you haven't gotten the right intervention and you're beating your head against the wall at school every day. So,
well, Dr. Forcelli, you're amazing. Thank you for coming on.
Oh, thank you.
It was so nice to meet you in Washington, D.C., and to keep this going. We definitely want to have you back on your wealth
Absolutely.
of knowledge.
Yeah.
So,
Wealth of knowledge. Maybe you'll sing opera next time.
yes.
We'll discuss.
I love it. I'm kidding. But yes.
You sing opera.
No.
You sing and I'll sing.
Oh, wow.
You
All
sing
right,
and
we'll
I'll
talk.
sing.
We'll talk. But thank you so much for having me. I think you guys are so important for parents because it helps them feel heard, and you're kind of you cull all the information for them so that they don't have to Google 9 different things. You have everything in one place for them if you kind of go through your podcast. So it's really great resource for them. And I'd love to come back to talk about other issues because an hour is definitely not enough to talk about everything.
Well, we'll talk.
Season 2.
Amazing.
Season 2. That's right.
So thank you again, and have a great weekend, and we'll talk to you soon.
Yeah.
Yes. Bye.
Okay, bye. Okay, so like we always say at the end of the show, hit it, Stephen.
If your child's struggling in school and you truly feel that it's something more than just a struggle, there's something that's just not clicking. You're going to know, your child knows. Start the process. It's easy process to start. We have templates on our website, www.empowerdyslexia.info. You can download those templates, turn it into your school to start the
There they are.
evaluation process. You'll be happy you did. Your child will be happy they did. And, you'll be able to put a name to it. You'll be able to figure out exactly what interventions you're going to need. And you're going to get them the help they deserve, right?
And guys, if you have a question, let us know. We're on Facebook. Send us a message. We get messages all the time. We try to get to them as fast as we can.
Yeah.
But yeah, so we're here. If you have a question about intervention or whatever, we'll try to set you up with the right person that knows more information because we're not the experts, but we talk to a lot of them. We're getting to know a lot
Absolutely.
of people out there, so to help you.
Well, be sure to go speak to your school boards.
Yes, don't forget to do that.
Send us your videos.
Yeah.
You know what? Let's do a competition.
Whoa,
For
what?
all the people that puts in a video, we'll do a drawing at the end of October
Okay, I like it.
for a free shirt,
Free T-shirt, yes, I
Empower
like it.
Dyslexia shirt.
Hey, I think I might go to my school board and testify.
There you go. Well, guys, thank you for joining us on this fabulous Friday. And it was we're having a good time.
Yeah,
right?
this is a fun.
Have
Happy
a great
birthday to me.
Yeah, happy birthday to Rachel. Have a great weekend, and we'll see you next time.
See you next time, guys.